everybody. Just talking about the sleep positions that we all sleep in. I think most of the complaints I've been having for shoulder and neck is usually because it's side sleeping or like sleeping like this kind of thing. Um, Lower back pain actually is really this. That actually creates tension in the back here, which also creates problems in this area, which then will bring pain in the lower back and in the upper back as well, in the mid back. So if you do find this problem, the best thing you can try to do, a lot of it is mattress. What you need to do is get kind of a firm, a semi-firm to a firm mattress. If you can get a really good one, that would be great. I know some people just don't have the money for that, but if you can get a firm mattress, that's better because then you can soften it if you ever needed to. So you can get a pillow top or whatever. But if you get a soft mattress, it usually doesn't work really well because then you cannot harden it if you needed that support. Okay, so most people have to throw away their mattress much earlier if they have a soft mattress. So I would suggest anywhere from a medium firm to a firm mattress, and that also really, if you're a side sleeper, I would totally suggest a pillow top on top of your mattress so that you have some sort of cushion, but you have the firmness of your mattress. So if you're a side sleeper, I would totally recommend a firm mattress. Then you can put a pillow top to kind of cushion the arm, okay? So there's a few things that I need to discuss about side sleeping because there's different types of side sleeping. Some people like to sleep like this, okay, with their hand under their head like this, okay? So this one is usually a double whammy in the arm, okay? So it's in the scapula right back here that usually causes a problem because of the cutting of the circulation. Then there's usually a bicep problem, okay? So something in here usually really hurts when you bring your arm out, okay? And there could be tendonitis because the tendons are getting tight. So, and also your head is on your hand. It really causes a lot of pain in the thumb and blah, blah. So, if you can, please do not put your hand under your head. That's probably the worst way to sleep and it can cause a lot of issues. As well, sleeping like this is really not the greatest for yourself as well because you can really create problems in the back and in upper back area. Neck, shoulder, same thing. The biggest thing for side sleepers is the jaw. Okay, so please, please, please do the jaw exercise if you have a sleep problem, okay? That will help you 100%. Get yourself a mouth guard, even a cheap one. You can get a hockey one. You can use your hockey. It's just when you clench and when you're going through grinding or if you're clenching your teeth, you're stressed. You just need to guard your teeth because your teeth could really, really get worn down. It can cause permanent nerve damage in the face. So I would totally suggest you guys to go to your dentist, get a nice mouth guard, or even go as cheap as just getting a hockey, one of those mouth guards, or even like the teeth whitening cushion like gel things that you put in your mouth. Even sleep with that if you can, because that will lessen the blow on the jaw, and then it would help with the problems in the shoulders. And maybe prevent some of the frozen shoulder kind of injuries that people get from sleeping incorrectly. Also, if you bring your hydration up, that would really help with the tendons not becoming inflamed, okay? Because if it's really dry, there's a sheath of white film, it's called fascia, that actually surrounds every single muscle in the body. And once that gets dry, it surrounds every muscle, the muscle gets suffocated. Okay, so what do you think happens to the muscle? It starts to really, all these signals here are your muscles talking to you, letting you know that there's something wrong in your body. So it's not good to ignore either and get cortisone shots and blah blah. You need to be able to communicate with your body. It's just a matter of finding out what it is. So the best way, if you're feeling pain, is just to kind of look, let me know how exactly you're feeling, and we can find out what's going on piece by piece. Okay, so sleeping, the best way to sleep, a lot of people wonder, what's the best way to sleep? No. We all kind of develop a sleep pattern early in our life, so it's kind of tough to really change that. But if you're one of those people who could subconsciously speak to to yourself, then you can go ahead and tell yourself, sleep on your back. Then some people can do it. But sleeping on your back is probably the safest. Now, some people sleep on their back and they sleep with their arms up, and that can cause problems into the lower back area, which could cause a problem with the abdominis muscles. But if you keep up with if you know you do that and you know you can't stop yourself from doing that, you can just do the exercises when you wake up, right? So that's these ones, and these ones, okay? Also the punching, the serratus muscles, right? So if you do go on your arm, okay, try to bring your shoulder rolled in, okay? So if you want, you can try to get a comfortable position, and you want to make sure your arm is kind of rolled in like this rather than on top of your body, so that it's directly on, all your weight is directly on your arm. Or if you're one of these people, this is not good either, because you're going to be cutting the circulation off in your arm here. And the brachial artery is right in your arm. It's one of the major arteries in your body. So I would totally suggest you to use a pillow of some sort, maybe. That one maybe goes a little longer. And then your arm come in this way. So it's a little more forward and more comfortable. Okay? Also, if you can, try to use your leg to go, your opposite leg to go over, right? Which is a more fetal-like position. If you're using this, okay, it can really cause a strain in the hip flexor muscles, okay? So more comfortably, I think it's best to sleep this way, okay? Now, a lot of people, they cross their arms, okay, and that also cuts off circulation, okay? So not much you can do about that, okay? But if you can, try to sleep with your arms down, okay? So I hope you guys use the information given, and I wish all you guys all the best, and have a great day.